You want to close the door to provide privacy for your client, and as you approach your client, you want to introduce yourself, which you are a nurse, explain the procedure that you'll be performing, and after their consent, can go ahead and lock the bed breaks. But before doing that, you want to make sure you have the right client by having them state their name and their date of birth. Now that you have their consent, you want to ensure that the bed breaks are locked, and you want to ensure that the wheelchair breaks are locked. Next, you're going to raise the bed to waist level to ensure that there's no straining on your back and you are able to perform proper body mechanics. When you have completed raising the bed to waist level, you are going to position the client by bringing them closer to the edge of the bed to make it easier to maneuver your transfer. Now you're going to ask the patient to turn on their side, and you're going to raise the head of the bed, and you're going to place one hand behind their shoulders and the other hand is going to be behind their knees, and you're going to go ahead and maneuver. Then you lower the bed to ensure that the bed is not too high, and once the bed is low enough, you're going to go ahead with your transfer. Now, before having the client stand up, you want to have them place their hands on the mattress, which will help them push off as they stand up. You also want to line your feet in front of their feet to ensure that there's no sliding during the transfer. Now you are going to guide them and ensure that the back of their legs touch the back of their chair and their arms are touching the chair. Now you are going to place the footrest on and continue with your next procedure. Before leaving the room, you want to ensure that you remove your gloves and perform hand hygiene.